Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions and get an inside look at the latest in healthcare, technology, and treatments. This is Rex on Call. Welcome to Rex on Call, live on WRAL. I'm Sharon Delaney for Rex Healthcare. Today we're talking about screenings for better health. If you're watching us live and you have questions on these topics, they could be answered by our experts. The physicians taking your questions today are Dr. Stephanie Foley with UNC Family Medicine in Hillsborough and Dr. Ben Walker with North Carolina Heart and Vascular. To call us here at Rex on Call, just dial the number on your screen, 919-744-3876. If you're watching us as we're streaming live on WRAL.com, you can email us your questions, rexoncall@rexhealth.com, or find us on Twitter and send us a message at Rex Healthcare, #RexOnCall. You know, we're so fortunate to live in an area where we have top-notch health care with nationally ranked research and medical institutions right in our own backyard. Of course, taking advantage of these resources with a proactive approach rather than reactive is important. One way to do that is to get screened on a regular basis to make sure you're not at risk for developing a chronic illness. Today, we'll talk about the many ways you can stay on top of your health, no matter what your age, from hypertension to cognitive to cholesterol to BMI screenings. We'll cover it all, starting with the youth. As you know, students are heading back to school. Some kids are year-round or already back in class. So it's a perfect time to schedule your child's annual physical, especially since North Carolina has just added some new vaccine requirements.
How have you been doing?
Good. She's going to check my ears and my mouth and my eyes and my heartbeat.
Smart girl. 8-year-old Sophia Allen is excited about going into the 3rd grade. So she and her mom, Christine, are visiting with Rex family physician Dr. Michelle Benton to make sure she's in tip-top shape.
She does have asthma. She was born with that. So when we also come here, she gets all her asthma medicines checked, make sure everything's up to date, and make sure her lungs can handle another sport season.
Because Sophia is an avid athlete.
Soccer, basketball, and softball.
And now is a good time to check your child's vaccinations records. This summer, North Carolina updated its guidelines to be more in line with CDC recommendations.
One big change is for children who are entering kindergarten. They now have to have 2 of the varicella vaccines, which is for chickenpox, and then they also have to have 4 of the polio and the pneumonia vaccines.
Dr. Benton says there are also changes for middle school students, including requirements for the Menactra, which is the meningitis vaccine, and the Tdap for the tetanus, diphtheria, pertussis vaccine. Not sure if your kids are up to date? Dr. Benton says your pediatrician or family doctor is the best resource.
So I would encourage, the parents to, of course, keep updated on well child checks, because that's where we usually update vaccines. And if they have any questions, to call the doctor's office and find out if their child is, behind or up to date.
Sophia gets a clean bill of health for a good school year and to hit the soccer field. It's also important to make appointments early because once school and sports get into full gear, it may take a few days or weeks to get in to see your child's doctor. Joining us now are Dr. Stephanie Foley and Dr. Ben Walker. Nice to have you with us today.
Thank you.
Dr. Foley, let's get started with talking a little bit more about those vaccine requirements for kids in North Carolina.
Sure. So the 2 major changes that we've seen this year are for kids entering kindergarten and for those going to middle school, specifically 7th grade. So that's changed just a little bit, even though the requirement for North Carolina has not been the same as the CDC in the past. What they're trying to do is get close to the CDC requirements. So the main changes for kindergarten are to have had all of your doses of the DTaP, the 2nd dose of the varicella vaccine, the full complement of the pneumonia vaccine.
The pneumonia one, okay.
Yes.
And then for middle school, is it a meningitis?
Yes, that's
Okay.
new for middle school requirement. And then they had the tetanus vaccine as well, and that's new for 7th grade if they haven't gotten it at that time.
Okay. Now, Dr. Walker, in preparing for today's show, I had spoken with Dr. Foley about some of the things that she has seen in her practice, and more kids that she was doing physicals for sports checkups, teenagers turning up with hypertension. And as a cardiologist, I mean, this has got to be worrisome.
It is. I think over nationwide, we're seeing more and more people who are developing metabolic derangements, such as diabetes, high blood pressure, and cholesterol at a very early age. This is concerning because these are kind of the precursors to developing worsening heart problems, such as heart attacks and strokes, earlier in life instead of what we normally would think of a later in life disease.
And are you seeing that in your practice, younger and younger patients coming in with what we would have expected at a much later time?
Sure. I tell people all the time that we used to think heart attack was an age process of 50, 60, or 70 years old, and more we're seeing it in 30-year-olds, 40-year-olds, and even rarely 20-year-olds.
So, as today's topic is about screening, so let's talk about some of these things in your practice that you have for every age group. You've got lots of different screenings, but I was most surprised about the young adult screenings and some of these things that, I don't know, maybe I didn't have a physical for 5 years. Unless I was sick, I never went to the doctor. And isn't that the experience of many young people?
Yes, and for some people that is appropriate. Certain age ranges, especially when you become a young adult, it's okay to go every other year. But what we typically want to do during those screenings is have a baseline cholesterol panel, and I'm sure you'll agree with that, blood sugar. Also check the body mass index, which is if your weight is appropriate for height. This is one of the first markers that we use to see if you're at risk for certain diseases like high blood pressure and diabetes, which would increase your risk for stroke and heart attacks later in life. Blood pressure is also something that should be screened at every visit, and sometimes the physical is just the only opportunity that people get to have their blood pressure checked. So all of these things are very important, even in the young population.
Yeah, because like you said, a baseline. I know that at pharmacies, they have that little chair that you can put your arm in. And I mean, is that worthwhile doing even to get a baseline per se, Dr. Walker?
I definitely think so. A lot of times when you're in the doctor's office or any type of medical office, people get a little bit revved up and they call it white coat hypertension. And even myself, when I go to the dentist and hear all those drills around me, my blood pressure increases too. So sometimes getting a blood pressure reading outside of all the stimuli at a medical office is a good thing too, because we can see more of a trend that happens, not just that one moment in time, but what happens throughout their entire life.
Okay, something that you talked about, Dr. Walker, is women really need to be paying more attention to heart disease because it does, in fact, take more lives than breast cancer, which does get, not to take any focus away from that, but there needs to be more focus put on to heart disease for women. Is that right?
I agree with that. I think in general we've done a wonderful job of screening women for breast cancer and done a good job with awareness for that. Unfortunately, in women's lifetime, they're 5 times more likely to die from heart disease and heart attacks than they are from breast cancer. And a lot of times the historical thought of heart disease was more of a men's disease, the larger people that may be smoking, diabetics, and just sitting on the couch and not doing a lot. But heart disease is everywhere, it's very prevalent, and last year over 500,000 people died from just having their new heart attack that wasn't diagnosed. Women can have more atypical presentations, and more we're realizing that it's the number one killer of women, just as that of men, so we need to be more of screening and raise awareness for that.
Okay. Dr. Foley, I have to say that some women I know, including me, rather than going to my family physician, sometimes I just sort of do the annual OBGYN visit and think that that's my physical and I'm good to go. But should there be things I should be asking more for as a middle-aged woman so that you can avoid these sorts of things?
Yeah, I think a lot of OBGYNs do a great job of doing preventive care, but sometimes they don't focus as much on cardiovascular disease and other preventive measures that we look at as a general, at the general population at your primary care doctor. And it is very appropriate for a certain age group to just get your OBGYN check. But as a woman, particularly as you become of a certain age, there are other screening things that we need to focus on, and that's when you really need to see your regular primary care family doctor. And that would be with regards to colonoscopy, screening for colorectal cancer disease, or other methods of screening for that. And also to review your immunizations. We were just talking about the new recommendations for childhood immunizations, but there are also new recommendations for adult immunizations as well. And we look at all of that during your physical.
Okay. Got to write that down as a to-do thing.
Yes.
All right, well, we are back right after the break to answer your questions. Give us a call, 919-744-3876, or you can send your questions by email, rexoncall@rexhealth.com.
Why settle for anything less than a Honda? Visit your Honda dealers of the Carolinas for the best selection and the best price on a new Honda.
Get blockbuster savings now at Bobby Murray Chevrolet. Customers are raving over the savings. Bill from Garner said,
Bobby Murray did me right on my new truck.
Visit BobbyMurray.com. Find new roads. Chevy makes the car.
Bobby Murray makes the difference.
With a tankless water heater from Schwartz Plumbing, you'll never run out of hot water again. This much hot water is life-changing.
I feel like a whole new person.
Would you like a loofah? Schwartz Plumbing, an Angie's List Super Service Award winner.
Check out the redesigned High School OT website.
Welcome back. This is Rex on Call live on WRAL, and today we're answering your questions on screenings for better health. And if you have questions for our experts, give us a call now at 919-744-3876 or email us at rexoncall@rexhealth.com. So let's take some of these questions. Brenda from Pikeville, she's 20 years old and has an overactive thyroid. What kind of, is currently on medication, but are there next steps? I mean, are you just on medicine for the rest of your life, or what are some other things that we can look at?
So for somebody who has an overactive thyroid, it's very important that they see an endocrinologist or a hormone specialist because there can be a variety of different reasons why their thyroid is overactive, and usually their treatment is based on the reason behind why they have an overactive thyroid. So for a lot of people, taking medication is fine, but that is something that should be checked at least on a yearly basis, if not at a shorter interval.
Now, the overactive, does that make you lose weight very quickly, or you don't gain weight very easily?
That can be one of the signs of hyperthyroidism or overactive thyroid. That doesn't always happen, though.
Okay. All right, this is Ben calling from Raleigh, and whenever he raises his arm over his head for over 30 seconds, he becomes short of breath, out of breath. Is this something indicative of possibly a heart condition?
Typically with most heart conditions, there's more of an exertional component to it. If you think about the heart as kind of like an engine, or something needs to get revved up, and when you rev it up, it normally sings to you, whether it's chest pain or arm pain. Some people can have conditions with their circulation when they elevate their arm above their head where it compresses certain parts of their circulation. So that's typically checked with blood pressure readings and sometimes ultrasounds of the circulation that could be evaluated. I would start with their primary care doctor just with basic blood pressure checks for that.
Okay, Ben, so you've got your marching orders to head to your primary care physician. Carpenter from Raleigh has asked, she has swelling around her ankles. Does this mean that there could possibly be a heart issue?
Yeah, the circulation in our body and swelling is a question we see a lot of. Most commonly, it's probably due to some of the venous congestion that we have. The valves in our vein can sometimes get weak over time from working hard and standing on your feet, but sometimes it could be related to the heart being overworked and then fluid backing up, and then by gravity it goes down to the ankles. So that's something that could be checked with laboratory, or just again start by seeing their primary doctor, and then depending on what that shows, we can determine if we need to do more workup. A lot of times heart conditions also have shortness of breath with it, or other problems with their breathing when they have it from the heart.
Okay. This person, Paul from Clayton, wants to know more about AFib, treatment options, screenings, and that's atrial fibrillation. Mm-hmm. Okay, and that is, I see commercials on TV about it. I think
you do.
Good or bad, whatever, right? So what is this condition?
You can answer that.
Sure. So atrial fibrillation is an irregular rhythm of the heart. The heart basically has 4 chambers, and one of the top chambers, instead of squeezing like a good pump, is shaking like a bad washing machine. With that, people can feel very symptomatic, but some people don't even know they're in it at all. More importantly, where you see the commercials is because of that washing machine, it doesn't clear the blood out and increase the risk of stroke because a clot can form inside the heart. So based off certain risk factors, they may need to be on a blood thinner if they do have atrial fibrillation, or at least an aspirin, and that's determined based on the other risk factors they have for stroke. But it is the most dangerous part of it, of course, is the stroke risk that's dramatically increased when you have atrial fibrillation.
So this person, Paul, needs to go see his primary care physician and then possibly on to a cardiologist.
Probably so.
Okay, all right. Well, coming up, we will have more of your questions being answered right here. Just call 919-744-3876 or email your questions to rexoncall@rexhealth.com. And as we go to break, we wanted to share with you some facts and screening recommendations when it comes to cancer prevention. Breast cancer is the most common cancer among women, affecting 1 in 8, and screenings typically started around age 40 and older, and you should get a mammogram every year in addition to regular self-breast exams. Prostate cancer is the most common cancer among men, affecting 1 in 7, and for screenings you should talk to your doctor about possibly getting a PSA test. And then lung cancer is the second most common cancer among men and women. Screening smokers and former smokers is a priority, and you may also qualify for another kind of screening test. We'll be right back.
Garner Wayside Furniture is the people's choice. They've been building customer loyalty for generations through dependability and quality service. Discover why people keep coming back.
Don't miss Garner Wayside Furniture's big Broy Hill sofa sale with optional setup and delivery and special orders on all Broy Hill furniture.
For Broyhill's best selection, visit Garner Wayside Furniture, the people's choice, located on Highway 70 between 401 and Timber Drive in Garner.
Get blockbuster savings now at Bobby Murray Chevrolet. Customers are raving over the savings. Bill from Garner said,
Bobby Murray did me right on my new truck.
Visit BobbyMurray.com. Find new roads. Chevy makes the car.
Bobby Murray makes the difference.
We're the 3rd generation of the Lafayette Ford family with some great news to share.
It's Lafayette Ford Summer Sales Event. Get a new 2016 Ford Fusion for just $17,999 after factory rebates. Or how about a new 2015 Ford Mustang for just $21,999? Or a new 2016 Ford Explorer for just $26,999.
Lafayette Ford is on Rayford Road in Fayetteville or online at LafayetteFord.com. Shop where we treat you like family. Lafayette Ford.
Why settle for anything less than a Honda? Visit your Honda dealers of the Carolinas for the best selection and the best price on a new Honda.
Welcome back to Rex on Call here live on WRAL. To reach us, you can call 919-744-3876 or email us at rexoncall@rexhealth.com. And we're taking your questions about screenings for better health. You know, more than 600,000 people die from complications related to cardiovascular disease every year. That is a startling figure and a reason early detection screenings are so vital. Fortunately, Rex is taking its screenings on the road to you. Welcome aboard Rex Healthcare's new mobile heart and vascular screening unit.
We've done these screenings before, just not on a mobile unit.
It's a screening center on wheels, well equipped to check cholesterol and blood pressure levels, as well as perform a series of ultrasounds. Rex cardiologist Dr. Ben Walker says these tests can be a lifesaver.
To look at the arteries that feed the brain. We also look at the overall pumping function of the heart to make sure it's squeezing and pumping blood okay. And then also look at the aorta, which is the big pipeline that feeds our abdomen and the rest of our lower part of our body.
If your test results reflect any abnormalities, you're then referred to a Rex cardiologist or vascular specialist.
Heart disease is in my family, and that was one of my main concerns, and I do have high blood pressure.
Helen Crane isn't taking any chances with her health. And that's the goal of the mobile unit, to improve awareness of cardiovascular disease, especially for those at risk.
My mom had a heart attack and she had lots of heart catheterizations and she ended up having a triple bypass.
Rex Diagnostic Services Manager Ashley Honeycutt has seen the value of early detection firsthand.
With some of these heart disease and stroke risks, sometimes depending on which one it is, you could be a walking time bomb. There's a risk of aneurysm, there's a risk of heart attack, a risk of stroke.
Hoping to catch a problem early for a better chance of recovery. So the goal is to not have the mobile unit ever parked anywhere, because you're really bringing this amazing technology to different parts of our area that wouldn't necessarily have access to great cardiology tests. So how are you seeing your interaction being on the mobile unit, Dr. Walker?
It's very early in its stages, and I think our goal is to start by going to local groups and businesses, to start, like you were mentioning, to remote locations, to get people that may not be getting their normal screening and seeing their primary care doctors, to get some of these vital tests so we can know if they are at risk for cardiovascular disease, heart attacks, or strokes.
Okay. So a couple different questions coming in. How often should a man ask to get a PSA reading after the age of 70? And this patient is a patient at Rex Family Physicians in Wake Forest.
Sure, that's a great question. It's actually quite controversial at this time. So the U.S. Preventive Task Force actually put out recommendations that we shouldn't be screening in most men with prostate antigen or PSA or a digital rectal exam for prostate cancer, because they found a lot of evidence stating that sometimes we cause harm by checking for prostate cancer. PSA is not the best test for detection, and a lot of times we ended up doing biopsies and invasive procedures on men and giving them complications from that and not catching cancer. So there are two sets of guidelines, the U.S. Preventive Task Force guideline and the Urological Association, American Urological Association guidelines. After age 70, really screening is not recommended as much. I think the Urological Association says you should screen until the age of 75. But with these new recommendations, most men are considered to be low risk and kind of fall out of that group. So only we would continue to screen in somebody who's had prostate cancer themselves, has a strong family history of it. That would be pretty much the only time we would do that.
Okay, all right. Sandra has called in. She is a pacemaker, a lot of numbness, her toes and her feet, wants to know what might be causing this, and she's not on any meds for this numbness. Is that a typical symptom of having a pacemaker?
Generally speaking, the pacemaker is located right below your collarbone, and it normally doesn't affect the nerve endings of the body. You want to look out for things like diabetes. That's a little bit more common for people to have numbness in their gloves where their hands are or their feet. That's a more common thing. I think getting their pacemaker checked and whoever put the device in is probably a good place to start and see if there's any swelling there or any problems. That's where I would go with those symptoms.
All right, very good. Thank you so much. We will have a final round of questions right after the break. This is Rex on Call.
Why settle for anything less than a Honda? Visit your Honda dealers of the Carolinas for the best selection and the best price on a new Honda.
Get blockbuster savings now at Bobby Murray Chevrolet. Customers are raving over the savings. Bill from Garner said,
Bobby Murray did me right on my new truck.
Visit BobbyMurray.com. Find new roads. Chevy makes the car.
Bobby Murray makes the difference.
With a tankless water heater from Schwartz Plumbing, you'll never run out of hot water again. This much hot water is life-changing.
I feel like a whole new person.
Would you like a loofah? Schwartz Plumbing, an Angie's List Super Service Award winner.
Welcome back to the show. This is Rex on Call. We're taking our final rounds of questions right now. Carrie called in. She suffers from anxiety and every so often has extreme shortness of breath for a short period of time. Should she be worried?
So for the most part, it sounds like definitely it needs to be looked at. Most likely it is related to anxiety, and a lot of times panic attacks or anxiety attacks come with shortness of breath. Sometimes they come with chest pain, dizziness, lightheadedness, but you always want to make sure that it is related to anxiety and not to a cardiac problem.
Okay. All right. Anthony wants to know, he's been told that he's anemic. His doctor wants him to get a colonoscopy. Is there any issue with moving forward with that screening, being anemic?
No, there's no issue in moving forward with that screening. I think that is an excellent recommendation, and he should seriously consider it. A lot of times, cancer in the colon can start by bleeding and cause anemia, and sometimes that's the first way we pick it up. So you want to make sure you're not missing anything.
Okay. Carolyn has called in. She's 70 years old, has pain in her right leg after she does exercise, and can hear things popping. That almost sounds like an orthopedic issue, but being 70 and exercising, which is a good thing, right?
Absolutely.
Would there be any time that you would need to recommend someone hold back on that?
Yeah, I think in general, when people have exertional symptoms, back to our analogy with the pipes and the plumbing of the body, if blood flow is not getting through one of the arteries, it sometimes can cause pain in the leg or the leg right below that. So generally seeing one of her providers and getting her pulses checked is a good place to start. With the cracking and the kind of musculoskeletal complaints, you think this may be more related to outside the circulation.
Okay.
But again, it'd be great to be evaluated and
Sure.
maybe need an x-ray or something to that effect.
Okay. Linda is 69, had a hysterectomy. Should she still be going to a gynecologist?
She should still be getting gynecological exams, and by that I mean not necessarily getting a pap smear or a pelvic exam, which are no longer recommended unless somebody has symptoms. If her uterus is gone, there's no sense in doing a pap smear anymore unless it was removed for cancer reasons.
Okay.
She still needs to have a breast exam and her regular screening. So yes, I would recommend a screening exam for her.
Okay. Sarah wants to know, at age 11, she was diagnosed with a heart condition. She's now 21. Should she be followed? She had mitral valve prolapse and an enlarged aorta. This is not something you grow out of, per se, Dr. Walker?
That's right. Mitral valve prolapse is when one of the valves in the heart doesn't make a good seal and has a little bit of a ballooning effect to it. Most of the time it's very harmless and does not cause people any problems, but you can tell by symptoms that they're having, and if she does have an enlarged aorta, that probably needs to be reevaluated, either with an ultrasound or potentially more looking at how big that is, because that can be a problem down the road.
Down the road, okay. Lots and lots of information that we have had here today that we've discussed, and we want to thank you for your time and your expertise. And always, please do consult with your physician about any health concerns that you might be having. And if you are looking for a doctor beyond today's show, or if you need, for example, a direct referral, you can call Rex Health Nets. It's their free telephone information service. And the number's on your screen. It's 919-784-4490. We'd like to thank our very busy phone bank today. They are still taking your calls right now. We will be getting these questions moved on to our physicians today, so don't worry if your question wasn't answered on air. And please do join us next month for Rex on Call. Our topic is gynecologic and prostate health. You can email your questions ahead of time to rexoncall@rexhealth.com. We'll see you then.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.